Vice President has been commenting at measures to shore up revenue in the country. We'll talk all about that shortly. But for now, let's talk about this. The minority in Parliament is this afternoon tearing into government's plan to recruit and deploy senior high school graduates to CHIPS compounds across the country. The Youth Employment Agency, which is seeking to implement the project, says the SHS Graduates will assist with basic healthcare delivery, such as record keeping, the medical history of patients at CHIP compounds, which is located largely in the rural parts of Ghana. The Ghana Registered Nurses and Midwives Association is kicking against that and has described the move as disturbing. According to a member of the Health Committee in Parliament, Dr. Sebastian Sandari, the program will fail and have no impact on healthcare delivery.
They don't have any space and they have no role. Bear in mind, these are people that have not finished their education. The focus should be, how do we ensure that senior high graduates, have the opportunity to continue with their education? If you train them, maybe just some few weeks or days of training, and you say they should go to CHIPS zones or be at the CHIP compounds, they have no role. Even the little they learn, at a point, will leave and go to school. So for how long are you going to be training? They are leaving and you are training. You do that when there's no other way of addressing the challenges. If there are no nurses, there are no community-based volunteers, then you say that, okay, we don't have the needed people. Then let's recruit anybody we can to do. But like I'm saying, you have the needed manpower, people with the skills, who rather are sitting at home, losing their skills. I mean, the nurses we have trained for years and they are sitting in the houses, they are sitting there decaying. And they have been trained, they have used years to train them. And you think that you rather train these ones for some weeks or some days, they won't make any impact at the CHIPS compound level. And they might bring some bad behaviors. Bear in mind, many are still teenagers. You get it? So why would you be exposing teenagers to all the risks and hazards at the CHIPS compound?
Well, so let's speak now to parliamentary correspondent Kweku Asante, who's been monitoring that engagement. Joins us in studio now. And Kweku, this issue started off yesterday, and I guess a day before yesterday, because we got that indication that minority is not pleased with this when Kwabena Mintah raised some concerns. But it's becoming evident that minority may be taking some steps against that policy move. What's the, utmost concern of the minority of this? So
the minority say that there are already volunteer groups at the CHIPS compounds across the country. And if government thinks they need some further reinforcement, then why not educate more these volunteer groups who are not qualified professionals strictly in its sense to do that job? Why are you going to give this job to SHS graduates who already do not have those skills, who have not completed their education to be doing this? And so they are not pleased about this. They are saying that government must deal with this immediately. We know Parliament is on break, else they will be forced to take some measures.
But what we saw, obviously, the YEA giving us reasons, and in fact the services that all of these persons will be recruited, about 5,000 of them, right, will be providing. Is that not enough grounds to give assurances to the MPs to say, well, they are not necessarily going in to be doctors or nurses?
Well, so what the minority are saying is that these are people who have just completed senior high school, mostly are teenagers. Why not allow them to complete their education? And if this is a field they want to come in, then you allow them to come. Instead of now boxing them at this, they are even having concerns that it could actually lead to some of these students telling their education at the SHS level because they have something on their hands in these CHIP compounds. We know that the Director General of the Ghana Health Service has provided some explanation. The minority says the explanation that the Director General of the Health Service has been provided is completely off the cuff and it's not something that will fix the challenge. Let's listen to Dr. Sandari.
The health of Mother Ghana and everybody in here. So we acknowledge the work of doctors, we acknowledge the work of nurses, we acknowledge the work of midwives and so on and so forth. However, I'm not sure everybody can do every kind of job in whichever field they are. And we have a basis for what we are doing, which is greatly supported by the World Health Organization, it's supported by the African Union, and it's supported by the Parliament of Ghana, the Ministry of Health. In fact, we are doing this under the auspices of the Ghana Health Service. It'd be very surprising to believe or think that the Ghana Health Service, the Health Subcommittee of the Parliament of Ghana, and the Ministry of Health have not gone through all of these things that we are talking about and have not really thought about it. What we are doing is, first of all, to create employment for the young people, young men and women of Ghana. Secondly, to attend to primary health care delivery in preventable health care, and especially in the rural communities. We are not posting anybody to any big hospital like the Bank Hospital here in Accra. We are not posting anybody to, for example, the Tamale Regional Hospital or the Northern Regional Hospital in Tamale. We are posting them to the Chief's compound. We are posting them not to act as nurses. We have been very explicit on this. Not to act as nurses, not to act as doctors, but to act as preventive health service officers. My brother, you would agree with me that we are in the rainy season, for example. Cholera usually comes out as an outbreak every rainy season here in Ghana. What do we do that we get cholera as an outbreak every rainy season here in Ghana? It is because of little practices that we have in our homes.
Yeah, but if you may, I mean, if you look at the concerns from the group, they're saying the CHIPS compound actually formed the basic unit of our healthcare system. You don't want to toll that, particularly knowing how difficult it is for some in the rural communities to access some of the district facilities.
Why did we write that community health service providers are going to man the CHIP compounds? We haven't said that anywhere. We are not saying that they are going to be administrators of CHIP compounds. We have not said that they are going to administer injections to anybody. We have not said that they are even going to take temperatures of anybody. They are going to assist the professionals.
But there are a raft of measures, or I mean, some of the services they'll be able to provide, and that, for instance.
So if I may,
you have a list of that. Yes,
explain it.
Right.
If I may, he understands that none of our recruited people are going to provide these services that are provided by professional health service providers, and that is what we are talking about. That, for example, pick a folder for me. If I'm a nurse and I'm attending to a patient, pick a folder for me. What kind of expertise do you need to pick a folder for someone? Attend to or educate people in their houses or.
Well, so that's Kwesi Ifri, happens to be Director of Corporate Affairs at the Youth Employment Agency. So, but minority still says, well, that's not a good justification.
Indeed, they've been labeling this justification from YEA itself as well as justification from the Director General of the Ghana Health Service that these explanations that they are giving are afterthoughts and that this program is just bound to fail and it's something that they want them to draw back on. Let's listen.
I listened to the Director General of the Ghana Health Service in an attempt to defend this bad policy, saying that the problem of CHIPS services at the community level is linkage with the community. Linkage with the community, if even is a problem, then we have to look at why it is a problem. Because the CHO has community-based volunteers, and their role is to link the community with the service delivery, because the CHO might not come from the community. The CHO might not know all the community and the community dynamics. So you have the community health volunteers chosen by the community people themselves. So if they feel they need somebody who can read and write, it's well designed. And you have these volunteers who have been working for years, volunteering, meaning they are sacrificing. So the problem, I think, which the Director General is failing to talk about is that these community-based volunteers at the chief zone level have not been motivated for years. They don't have the needed logistics to work with. No even common bicycles, no mobile phones, no motorbikes for CHOs, no fuel. These are the problems. And therefore, if there's any intervention, then see how you motivate the already existing community-based volunteers to be motivated to work.